Okay, so today is part 2 of medication coverage in BC. Again, we're navigating Pharmacare and WorkSafe BC in terms of drug coverage, specifically for pain meds. So the overview will be navigating Pharmacare drug coverage, navigating WorkSafe BC drug coverage, and the specific coverage for NSAIDs, non-steroidal anti-inflammatory drugs, opioids, adjuvant medications used for pain, and antidepressants and sleeping tablets. A little bit of a recap from last week's webinar in case some of you were not able to listen to it last week. There are a couple of different Pharmacare plans. The Pharmacare Plan A is the universal Pharmacare plan that covers most residents of BC. Then there's Plan B, Plan C, Plan D, Plan F, Plan G, and the BC Palliative Care Benefits Program, which is known as Plan P. Each plan has got different criteria, and if a medication is covered under Pharmacare, it does not mean that it's covered under all Pharmacare plans. There is a place online where one can see which Pharmacare plan covers which medications, and we will go through that later on in the presentation. To recap as well on the Pharmacare programs and give you some definitions. So the Pharmacare programs include LCA, which stands for Low Cost Alternative Program, the RDP, the Reference Drug Program, Limited Coverage Drugs, and Special Authority. So to define those, the Low Cost Alternative Program. The Low Cost Alternative Program covers lower priced, often known as generic drugs. Again, to remind everybody that generic drugs contain the same active ingredient, have got the same therapeutic response, but are lower priced. Generic drugs are categorized based on the drug, the strength, and the formula. So what Pharmacare does is it sets a maximum cost for the drugs in each category. This is based on the price of the least expensive products in the category. So for example, if there is a specific drug like ibuprofen, at a strength of 200 milligrams in a tablet form, Pharmacare will find the cheapest ibuprofen with that strength in a tablet form and use that as the maximum cost that will cover for ibuprofen at 200 milligrams in a tablet form. And so that will be known as low-cost alternative. Now, if you cannot take a low-cost alternative drug that is covered by Pharmacare, your healthcare practitioner can request special authority coverage for another drug in that category. The next program is known as the Reference Drug Program. This applies to a group of drugs used to treat the same condition. Pharmacare provides full coverage of the drug, which is the most medically effective and the most cost-effective in the category. This drug is called the reference drug. Again, if you cannot take the reference drug that Pharmacare provides full coverage for, then your healthcare practitioner can request special authority coverage of another drug in that category. At the moment, there are 5 classes of drugs that are included in the reference drug program, and the only one that's applicable to today's presentation is the NSAIDs, the non-steroidal anti-inflammatory drugs. So this is a group of drugs. There are many different ingredients. They're all known as anti-inflammatories, so they treat the same condition, which is inflammation. And Pharmacare provides full coverage of 1 or 2 drugs within that category that seems to be the most medically effective and the most cost-effective. The next program is known as the limited coverage drugs. These are drugs that are not the standard first treatment of choice, and these are drugs for which there are more cost-effective alternatives available. So if there is a medical need for one of these drugs to be covered, then your healthcare practitioner can request a special authority to have these drugs covered. So these fall into a different group according to Pharmacare coverage rules. And then we come to special authority. So the special authority program will cover the full cost of a medication that would otherwise be partially covered for a limited coverage drug. Special authority applies to a specific drug for an individual patient. A healthcare practitioner, normally a physician, must request the special authority. Special authority coverage, when granted, may be for a limited time or indefinite, and that depends on the drug. Special authority, if it applies to a specific drug, the special authority paperwork and approval must be in place before you purchase the drug. In other words, must be in place before the prescription is filled. Coverage cannot be provided retroactively. If a drug is eligible for special authority, there are certain criteria that have to be met for coverage, and we will go through the criteria for some of the drugs. Some drugs are not eligible for a special authority, and again, special authority, if it is available for special medication, the criteria have to be met before it is given by pharmacare for the patient. So now we'll move into some more specific drug coverage, and we'll start off with the non-steroidal anti-inflammatory drugs. The non-steroidal anti-inflammatory drugs, in terms of the special authority process, fall into 4 groups. Group 1 is known as the reference drug program, and that includes aspirin, ibuprofen, naproxen. So these are called reference drugs, and pharmacare provides full coverage for these drugs. Group 2 of the non-steroidal anti-inflammatory drugs apply to a group of drugs which are listed in a table, which we'll go through later on. And if there is, and the patient has to prove that there has been treatment failure or intolerance to at least one drug in Group 1 in order to qualify for coverage under Group 2. Partial coverage exists without special authority up to the reference price. Now for Group 3 and 4, this is for the limited use drug program. The criteria are treatment failure or intolerance to Tylenol, a reference drug in Group 1, and at least 3 other non-steroidal anti-inflammatory drugs from Group 1 or 2. And coverage here is only provided with special authority approval. Now, in terms of specific coverage for specific anti-inflammatories, naproxen is for this specific medication, special authority is not required. The reference drug program applies to enteric-coated and sustained release products. Maximum pricing policy applies, so pharmacare has set a maximum amount that it will pay for a naproxen product. Certain brands are not covered. That means naproxen produced by certain manufacturers is not covered by pharmacare because of the price of that specific product. And naproxen sodium is not covered by any of the pharmacare plans. In terms of diclofenac, special authority is not required for coverage. Again, maximum pricing policy applies. The pharmacare has set a maximum that it will pay for diclofenac tablets. Some products from specific manufacturers are not covered, and the reference drug program applies. Diclofenac is a reference drug. Celecoxib, also known as Celebrex. This is only covered by special authority, so special authority is required for coverage of Celebrex, and there is a maximum pricing policy that applies. Meloxicam, for this medication too, we need to have special authority in place for it to be covered. Some products produced by some manufacturers of meloxicam are not covered, and again, maximum pricing policies apply. Indomethacin, also known as Indocid, special authority here is not required. Maximum pricing policy applies. Some products by certain manufacturers are not covered, and it's also a reference drug, so the reference drug program applies. Ibuprofen, this is also subject to maximum pricing policies for pharmacare. Some products are not covered, but there are some specific manufacturers that produce ibuprofen 200 milligram, 400 milligram, and 600 milligram tablets that are covered by pharmacare. So even though 200 milligram and 400 milligram tablets are over-the-counter products, if you have a prescription, you can get them covered, provided you get the right generic that is covered by pharmacare. Piroxicam, special authority is required for this product. Maximum pricing policy applies, and the reference drug program is applicable in this case. Nabumetone, not very commonly used, but it requires a special authority. Again, maximum pricing policy applies, and it's part of the reference drug program. And for ketorolac, also known as Toradol, there is no coverage by Pharmacare.
Okay, let's go to coverage of the opioid medications under Pharmacare. I'll go to each of the drugs available in Canada right now. So codeine, there are two formulations, the short-acting codeine, just like the regular codeine and the codeine combinations products, such as the Tylenol with codeine products. Special authority is not required. However, these are subject to LCA, low-cost alternative, and also maximum pricing policy. And again, certain products are not covered. So your pharmacist would know which products are covered and which are not, like which brands of the generic would be covered and which aren't. For long-acting codeine, the codeine content, it is covered with special authority, and the criteria for that is you're not able to tolerate the regular form of codeine, the short-acting codeine, or if you've tried the short-acting codeine and did not get an adequate response. And for morphine, both the short-acting and the long-acting morphine are covered. Special authority is not required. And again, all the products are subject to low-cost alternative and maximum pricing policies. And again, certain products are not covered. So Pharmacare has a list of which brands are covered and which aren't. Your pharmacist will be able to do that. And we'll also show you later on in the presentations how to check on the Pharmacare website which products are covered and which one aren't. The hydromorphone, the short-acting ones, such as the Dilaudid or the generic Apol hydromorphone, PMS hydromorphone, Teva hydromorphone, are covered, again, subject to low-cost alternative and maximum pricing policies. The long-acting hydromorphones, such as the hydromorph content and the Junista, are covered under special authority, and the criteria for that are if you are unable to tolerate or if you've tried the regular release form of hydromorphone or the sustained release form of the morphine, and did not get an adequate response to it. And oxycodone, the short-acting ones, are covered without special authority, and again, subject to low-cost alternative and maximum pricing. Again, certain products are not covered. And the long-acting oxycodone, the Oxyneo, is only covered under palliative care right now. For Fair Pharmacare, it may be covered under special exemption, which means that your physicians would have to write a letter to Pharmacare documenting that you've tried other opioids such as codeine, morphine, hydromorphone, and even the fentanyl patches with no adequate response. Then they may consider it, and it's on a case-by-case basis. Targan, which is the combination product of oxycodone and naloxone, is not a benefit under any of the Pharmacare plans. Yes, there was a question regarding if Targan is covered under Fair Pharmacare, and it's not. And it's not covered under special exemptions either. So even if your physician writes a letter to Pharmacare, they won't cover it. And fentanyl patches are covered with special authority if you have tried and have not responded to or was intolerant to the conventional oral opioids such as codeine, oxycodone, morphone, or hydromorphone. And it was interesting, Marylene and I was talking about it, and she didn't know that fentanyl was available under special authority criteria. So, I mean, it's not transparent and it's not clear to pharmacists out there what's covered and what's not covered. So maybe as a patient, you might have to tell them to, do the search for you. And it's not clear. Not everybody knows or is aware of the coverage policies for all of the opioids under Fair Pharmacare. Marylene, do you have anything to add to that?
Yeah, that's correct. So I think what's important for the public is to question the pharmacist and tell them to look into the actual criteria and to look into the Pharmacare website, and the patients can do it themselves and find out what is covered and what is not covered, and then advocate for yourself to get it covered if it is, because sometimes the health professionals, pharmacists and doctors are also not completely aware of all the rules and regulations. And there are so many of them, so many rules and regulations, and they're updated and changed all the time. So it's a matter of navigating the system and getting covered for what you could be covered for. As you said, there are many medications that do not have coverage, but I think there are times when coverage is available and maybe the public is not getting the full benefit of it because of ignorance of the system or the way the system works.
Mm-hmm. And the fentanyl sublingual, the Astral, is not a benefit under any plan. And we have a question from the audience. I'm going to read the question out. I'm currently on fentanyl and have been on it for over a year. Can I switch to another drug of equal strength and what it is? So yes, you can be rotated to a different opioid, and it's depending on the strength of your medication right now, and your pharmacists and physicians would be able to do a conversion, switch over to another opioid, depending on what you've tried in the past. And yeah, it's a general question, so it's really hard for us to tell you which medication. So we have no idea what you've tried and have not responded to, and your dosage and all of that. So the best person to discuss this is with your physicians and pharmacists.
And again on the same question, yes, fentanyl can be rotated, as Thuy said, to another opioid. More than likely not to another patch, because there are not many other patches available. But for sure, we can find an equivalent strength of what you're on right now. However, this is not part of the scope of this presentation. And we had one more question as well. One of the attendees' question was that they're taking MS-Lon and Dilaudid and can only get the prescription filled once a month. And the Pharmacare restricts payment to once a month, and it makes it difficult for this person to get away for a longer period of time because they need their medication. So in terms of coverage, Pharmacare has got rules in terms of time limits that they cover medications for. Most medications are covered for 100 days supply. However, narcotics, opioids, and sleeping tablets are limited to a 35-day supply. So in terms of holiday supply, you either have to get it filled every 35 days, or otherwise you can ask for a larger amount, provided the doctor gives you a prescription for a larger amount. However, you would have to pay the difference of what Pharmacare covers and what is not covered by Pharmacare. So if you had to get a 60-day supply, Pharmacare would cover 35 days, and the patient would pay the 25-day supply out of their own pocket.
Okay, so let's move on to the next drug, which is tramadol. Neither the short-acting tramadol or the long-acting tramadol are benefits under any plan. Well, I know some physicians have small sample amounts that they can give out to the patients, but that's not going to help if you've got chronic pain and have to be on it for a long term. Tapentadol, the long-acting tapentadol Nucynta, is not a benefit under any plan. And methadone, special authority is not required, so it's covered, again, subject to low-cost alternative and maximum pricing policy. The next drug is buprenorphine, such as the U-Trans patch, not of benefit at all under any of their pharmacare program. The Suboxone, which is a combination of buprenorphine and naloxone tablets, is covered under special authority only for the treatment of opioid dependence, and is not authorized for the treatment of chronic pain. And for treatment of opioid dependence, then the patient would have to try methadone, or if methadone is contraindicated, for example, if the patient is at high risk of QTc prolongation, which is a cardiac condition, and for those who have hypersensitivity to methadone, or if you've tried the methadone and have not responded to methadone. Moving on to the adjuvant medications, such as the antidepressants. Tricyclic antidepressants such as amitriptyline, nortriptyline, imipramine, and desipramine covered, subject again to low-cost alternative and maximum pricing policy. Venlafaxine or Effexor is covered, again subject to LCA and maximum pricing. Duloxetine, Cymbalta, is not a benefit. It may be covered under special exemption, and again, your physicians would have to write a letter to Pharmacare documenting all the medications that you've tried and have not responded to, and it may be covered on rare occasions. And I know there's been quite a few patients who posted on the PNBC Facebook regarding coverage for Cymbalta for fibromyalgia. Unfortunately, I mean, it's only covered under special exemptions in very rare cases. Marylene, do you have anything to add to that?
No, I think if as a patient, if you've tried everything else and Cymbalta is the only one that works and is the last resort, and you are finding it effective, I would speak to your physician and tell them to write a letter documenting what you've tried, what the special circumstances are, and again, there is a possibility, although being a slim one, but there is a possibility for special exemption on an individual case-by-case basis.
And the anticonvulsants, gabapentin, carbamazepine, topiramate, or divalproex, such as Epidol, those are covered. There's no need for special authority, and they are subject to, again, low-cost alternative and maximum pricing policy. Lyrica or pregabalin is not a benefit.
So with Lyrica, it's not a benefit. However, Pfizer has a patient assistance program. Pfizer is the manufacturer of the brand name Lyrica. And what the patient assistance program provides is coverage of the difference between the generic cost and the brand name. So in other words, with Pfizer's financial support, you can get a prescription for the brand name Lyrica at the generic price. However, you will still have to pay for the generic price because that is not covered by Pharmacare.
Moving on to the cannabis cannabinoids, Nabilone, or also known as Zephamet, the brand name Zephamet, special authority is not required, and again is subject to low-cost alternative and maximum pricing. And medical marijuana is not a benefit under any plan.
Now, in terms of Theratos hypnotics, there are many different medications that can be used for sleep. For example, there's the benzodiazepines and trazodone. But we're mentioning Zopiclone because that is one that's very commonly used. And for Zopiclone, the The maximum day supply is limited to 35 days per fill. Maximum pricing policy applies. Zopiclone is only covered with a special authority, and some products of Zopiclone are not covered by Pharmacare, even with special authority. So we will navigate through to the Pharmacare website. So if you need some more information on specific drug coverage, you can search the Pharmacare formulary online, and the website is www.health.gov.bc.ca/Pharmacare/benefits-lookup. And we will go straight to that site now so we can show you how to navigate the website. So when we go into that website, give me a moment here. Okay. So this is the benefits lookup web address that I just gave you, and we can go into a formulary search. This is the page that comes up.
Why don't we just go back to the home page and then just lead the audience through how to get to this page?
Okay. So Pharmacare home. So we're going to Pharmacare home page, then go into drug coverage on the left-hand side. So anyway, so this is how Pharmacare does its drug coverage decisions, which is also a good thing for you to know, and how to make your voice heard about specific medications and what the results of drug coverage decisions are. So that's a handy one for you to know. And specifically looking up the formulary, if you go into general coverage policies, and at the bottom here, we will find the formulary search. If you click on that, it'll bring you to that website that I just mentioned in the presentation, health.gov.bc.ca Pharmacare Benefits Lookup. And then you click on the Search the Pharmacare Formulary tab right at the bottom of the page. And on there, all you need to know is the generic or the brand name of the product you're looking for. So for example, I'm going to put in Zopiclone. Then you do a search. And then these are all the products of Zopiclone that come up. So this is the drug identification number. This is the generic name, Zopiclone. These are the brand names and then manufacturers. This is the reference drug pricing, so that means that Zopiclone does not fall into the reference drug program. Here it shows us that the maximum day supply that Pharmacare will pay for is 35 days. These are the products that are covered by Pharmacare. So Imovane 7.5, the brand name, is covered by Pharmacare. Imovane 5 milligram is covered by Pharmacare. And the generics, PMS Zopiclone and Apro Zopiclone, are covered by Pharmacare. And then on the right-hand corner, it says special authority needed. So if you go into the right-hand corner and you click on special authority, it'll give you the criteria for the special authority. So for example, for Zopiclone, in order to get Zopiclone covered, you need to have special authority in place. And the criteria are as follows. Pharmacare will cover Zopiclone to treat insomnia with a diagnosis of AIDS, or to treat insomnia with a diagnosis of a psychiatric illness, or to treat insomnia with a patient who has tried and has failed on 3 benzodiazepines in the past, or for the treatment of insomnia for a person who has tried at least 2 benzodiazepines and 1 other specific hypnotic agent in the past, or for the treatment of insomnia with a person who has a history of drug or alcohol addiction, or the treatment of insomnia for somebody who's fragile and elderly. So if you fall within one of these conditions or criteria, then you would qualify for a special authority, which has to be applied for by your family physician. If one of these criteria do not apply to you, then even though there is special authority available for Zopiclone, unfortunately, it will not be covered in your case. Going back to that table here, if you click on the left-hand side where the DIN is, the drug identification number, it'll give you a brief summary of the coverage of the drug. So it'll give you Zopiclone, and here's a summary that it's available only with special authority coverage. This is a summary for all Zopiclone products. And going back to this table again, if we look at this product here, the PMS Zopiclone, this is done by Pharmascience for this specific product. From Pharmascience, Pharmacare does not pay for it, and that's a pricing issue. So this formulary research can be really helpful. All you need to have is the name of the drug. Just put it up there and search, and then a lot of questions can be answered that way. And then you can advocate for yourself and speak to your pharmacist and speak to your physicians to get something covered if it is eligible for coverage.
Okay, so let me just try to lead you through one, say for Oxymel. I'm just going to put in Oxymel and search for that. So on here, at first glance, it looked like it's covered under Pharmacare without special authority. However, if you click onto the DIN, it will tell you which plan Pharmacare covers it under, and the only plan that it's covered under is palliative care. So, I mean, some physicians, when they just look up and without drilling down, they just assume that it might be covered. So you might have to just do the search yourself and, you know, give the physicians the information. They may not know that. For something that's a full coverage, such as, say, morphine, then I would just show you that it lists all of the plan that is covered if we drill down by using the DIN number. For example, let's just take MOS 10 milligrams. And then we click down, and it lists all the plans that Pharmacare covers it's under. And with the day supply fulfills 35 days max. Anything else to add to the search engine, Marylene?
No, I think that's fine. I think we can continue with the presentation. So let's go back to the presentation, and so we briefly went over how to make your voice heard. That is the website address there, Pharmacare Your Voice. And here you can go into the Pharmacare website and see what decisions are being made on which drugs.
Right now, okay, why don't we just go back? Can we go back to the website, Marylene? Just go back to where you can put in your voice, your input to have coverage. Right now, the only drug that applies to the audience, like the chronic pain population, is Botox. I think Pharmacare is asking for input on coverage of Botox for treatment of migraine. So we go to making your voice heard, input the drug reviews for patients, click on that. It will take you to a link, and if we scroll down to the bottom, these are the drugs that are being currently reviewed, and Botox right now. So you do have from now until March 17th at midnight to put in your input and that may have an impact on the decisions on Pharmacare end to decide whether or not they will cover it for the treatment of chronic migraine.
And these drugs change from time to time, and the rest of them that are listed here are not related to pain, except for the Botox. So getting back to the presentation, we're moving on to coverage through WorkSafe BC.
Okay, so before I do that, I like to disclose that I am an employee at WorkSafe. However, today I am not here as a representative from WorkSafe, and I will not be able to answer WorkSafe, like claim-related questions. Let's talk about, well, with WorkSafe, as long as your claim has been accepted, the conditions of chronic pain has been accepted under your claim, most medications are covered if they are prescribed by the physicians and the treatment seems reasonable and medically reasonable and appropriate. There are certain policies, coverage policies regarding opioids. So all oral opioids have coverage limited to a period of up to 8 weeks post-injury or post-surgery. And after the 8-week period, if opioids are continued to be prescribed, then a letter will be sent to the worker with a worker opioid narcotic agreement. It's like an agreement that you would sign with your physicians when they prescribe opioids for you. However, this is an agreement with WorkSafe, and it has conditions such as you will take your medication as prescribed, you do not share it, sell it, or take other medications and not get prescription filled by different physicians and, multi-doctoring and going to the ER for your medications. Just conditions that are similar to the contract that you would sign with your physician. And if those conditions are breached, then WorkSafe may cease to cover opioids further. And also at the same time, the physicians will get a letter from WorkSafe with the physician's response on opioid funding extensions request form. And these forms must be completed and returned to WorkSafe BC for considerations of further extensions of coverage. And on the form to the physician, they have to fill in what the diagnoses are, whether or not opioids have helped in terms of pain level, and also whether or not it has improved in your function. So once those forms are returned back to WorkSafe, then the WorkSafe BC medical advisors review the completed forms and the relevant medical information on your file, and they will provide an opinion as whether or not there are special and extenuating circumstances to support ongoing payment of the opioid medications. And if extenuating circumstances do exist, then the coverage is authorized for up to 1 year, and it has to be reviewed at least annually. In terms of coverage for cannabis and cannabinoids, Nabilone or Sesamed is covered only under exceptional circumstances on a case-by-case basis, and the medical marijuana is not a benefit at all. If you need further information on specific drug coverage, you can either contact your WorkSafe case managers or the WorkSafe BC pharmacy team at 604-276-3085, extension 1655, or if you live outside of the Lower Mainland, then you can call the toll-free number at 1-888-422-2228, extension 1655. And just a brief touch on the appeal process. So if your drug coverage is denied, you can ask for a decision letter outlining the reasons for the decision. And if you disagree with the decisions, you have 90 days to have the decision reviewed through the WorkSafe BC Review Division. And if you, again, disagree with the review decisions, you can appeal through the Workers' Compensation Appeal Tribunal, known as WCAT. And that has to be done within 30 days of the review decision. And if you need assistance with the appeal process, contact your Workers' Advisor's Office at www.labor.gov.bc.ca/WAD.
So we have another question. And the question is regarding a prescription for a narcotic for longer than 35-day supply in the case of the patient having to go on holiday and needing to take a larger supply with them. So as I mentioned, Pharmacare will only pay for 35 days at a time. But if you need a longer prescription, as long as you have a prescription for it from your doctor and you're willing to pay the difference, then you can get a larger supply. So the question is that the patient has a longer prescription from the doctor, but the pharmacist will not pay it, but will not fill it even if the patient pays. And who can be contacted at Pharmacare to deal with a situation like this? Well, this is not a Pharmacare issue because Pharmacare deals with payment issues, and if the patient is willing to pay for the extra supply, i.e. more than 35-day supply out of their own pocket, you can do that. That is not a Pharmacare issue. The issue there remains with the pharmacist. So find out from the pharmacist what the reason is that they will not fill the prescription. But if you do have a prescription that is for longer than 30 days, and as long as the doctor hasn't restricted on the prescription that it can only be filled at 35-day intervals, because sometimes a prescription can be written for a 3-month supply, but the doctor has written special instructions on the prescription that it can only be filled at 30-day intervals. So as long as there's no restriction on the prescription itself from the physician, and as long as you have a prescription from the physician for a larger quantity, and as long as you're willing to pay the difference of what Pharmacare does not cover, I don't see any problem with you getting that supply of medications. And if it continues to be an issue, then just find another pharmacist.
And also on the day supply for WorkSafe coverage, and again, we only cover for 30 days supply of opioids. However, for patients who are traveling out of town, either for work or for vacation, then the physicians will need to inform to request coverage on the patient's behalf. And WorkSafe usually requires that a conversation takes place between the physicians and the patients on the safety issues, such as safe storage of the huge quantity of opioids because of overdose concern, not only for the patients but also for the people around them. So as long as there's documentation that discussion has taken place, then WorkSafe will pay for fully for the first 30 days through the pharmacy coverage card. The patient will be required to pay for the remainder, but they can submit receipts for reimbursement afterwards.
We have another question here, and the question is, what is age of elderly? And I'm assuming this refers to the special authority criteria for the Zopiclone for frail and elderly. Anybody over the age of 65 would qualify for the definition of elderly in terms of Pharmacare coverage. Now, I think that concludes our presentation, but I would just also like to make a point of one more thing regarding Pharmacare coverage. Since it's the beginning of the year, Pharmacare coverage works on an annual coverage which starts from January the 1st and ends on December the 31st. And that annual coverage, the amount that you actually covered for in terms of drugs, depends on your income and your tax returns from 2 years ago. So in other words, if you have a higher income, which means that you do not qualify for coverage right away, then you would have a deductible to satisfy before Pharmacare would pay any costs of your medication. So when we imply that something is covered by Pharmacare, we mean that it either is covered at the point of purchase, or otherwise it is covered, meaning that that amount will add up towards your deductible for the year. And only once you reach a deductible, then Pharmacare will start paying some of the costs. So you'll see some Pharmacare payment coming off your receipts that you pay at the pharmacy counter. But until such time, coverage of Pharmacare drugs means that that drug is adding up towards your deductible. Non-coverage up to your deductible means that that drug or that purchase is not adding up towards your deductible. So therefore, if your deductible is $700, for example, it'll take you longer to reach the deductible because not every prescription will be adding up towards the deductible if a specific medication is not covered.
Great. Thank you so much. I want to thank Drs. Nguyen and Kyriazis for spending time with us and explaining in such great detail all of the rules governing pharmacare and WorkSafe. That was very helpful. Thank you so much, both of you.
Thank you. It was a pleasure.
Thank you, Michael. Thanks to the audience.
So to the attendees out there, I will be sending out a link to the presentation, to a recording of the presentation. I do ask if you could please just hang on for one more minute. As soon as we end the session, a short survey will pop up, and if you could please give us your feedback, we would really appreciate it. So on behalf of everyone at Pain BC and on behalf of Drs. Nguyen and Kyriazis, here's hoping that tomorrow is a day free from pain for all of us, and we'll see you at the next Pain BC event. Goodbye.
Bye.
Thank you. Bye-bye.